The issue that our group wants to discuss is how artificial intelligence can bridge the gap between Western and alternative medicine to support the delivery of holistic, culturally safe care. How can adaptive intelligence ensure inclusive and sustainable healthcare practice? Adaptive intelligence refers to the capability of a system or individual to dynamically adjust thinking and behavior in real world contexts, which in artificial intelligence enables continuous real time learning and hyper personalized execution. Clinical sustainability refers to a long term capacity of a healthcare system to consistently provide safe, effective diagnosis, treatment, and care while protecting patients from harm. Inclusivity refers to the requirement for healthcare services to actively respect, reflect, and adapt to each individual's unique identity, beliefs, needs, and circumstances. Firstly, since Western medicine often dominates clinical practice, the effectiveness of complementary and alternative medicines is often being overlooked. This strips patients of the chance to receive a more comprehensive healthcare service. Secondly, patients from diverse backgrounds often encounter communication barriers when seeking medical support, so they fail to understand the medical jargons, thereby failing to understand the purpose of taking different drugs. This results in a missed opportunity to receive optimal care, eventually causing patients to lose faith and disengage from the healthcare system.
Our solution is an integrative adaptive intelligence platform with three core functions. First, it stores and organizes patient information through a medical passport. Second, it analyzes that information to support clinical decision making. Third, it delivers personalized, culturally safe information back to the patients. Each function builds on the last.
The foundation of our platform is the Adaptive Intelligent Medical Passport, a shared AM maintained digital record. Unlike a standard medication list, it exclusively includes CAM use alongside Western medication. It flags interaction, track history, and it can be accessed by any provider involved in patient care from GP to an acupuncturist.
Medical Passport directly support both inclusivity and sustainability. For inclusivity, it validates CAM use, building trust with patients from diverse cultural backgrounds. Sustainably, it reduces redundancy, reducing repeat tests or consultations, saving time, money, and resources. Moreover, it prevents medication errors, creating better patient outcomes.
Building on the medical passport, our AI tool works in two ways. It analyzes patient data to detect risk and drug interactions. It creates a short cultural care summary, including language, traditional medicine use, and family preferences to support safer, culturally appropriate care.
By integrating CAMS into care planning, this tool helps deliver more holistic and culturally safe healthcare. Respecting patients' cultural beliefs and practices can strengthen trust, improve treatment adherence, and enhance health outcomes. This increased engagement in healthcare services supports earlier screening and intervention, promoting preventative healthcare, and contributing to a more sustainable healthcare system.
The third function focuses on the patient side, the Adaptive Intelligence Patient Communication Hub. It takes complex medical information and makes it genuinely accessible, translating it linguistically, simplifying jargon, and adding visual aids. It also integrates with telehealth so patients in rural areas, those with mobility limitations, or those who face language barriers can still access culturally safe healthcare from wherever they are.
Patients who don't understand their prescriptions don't take them correctly and disengage from the system entirely. This hub supports patients with diverse languages, cultures, and health literacy levels, ensuring that information is clear, accessible, and inclusive. Telehealth further reduces travel barriers for rural and mobility limited patients. When patients understand their care plans, they're more likely to follow them, leading to healthier outcomes. Informed patients practice preventive care and engage early with primary care services.
However, AI risks stereotyping and discrimination. Over relying on AI can weaken clinical judgment. Telehealth isn't equitable without support. No solution is without limitation, and we want to be transparent about ours. Preferences must be patient driven and consent based. AI tools are designed to support, not replace clinical judgment. Digital access must be equitable. We must ensure digitally excluded patients aren't disadvantaged by this system.
By and large, we want to utilize AI to create a medical passport, thereby supporting better clinical decision making to provide personalized and culturally safe information back to patients. We hope this can ensure equitable health outcomes and rebuild trust between diverse communities and healthcare systems. We firmly believe that AI should act as a bridge, not a barrier. Thank you.